Medicare does not cover dental, so what are your options? What can you do about this? My advice to you on this is going to depend on which path you go when it comes to either original Medicare or Medicare Advantage. If you stick with original Medicare, the program does not cover dental, but you can get a standalone plan in the marketplace. So when you look at these plans, one of the most important things you're going to think about is my dentist in that network? Because I've seen some really good plans, but when the dentist is not in the network, doesn't pay so well. So ask your dentist which plans do they accept as you start to look into that. Once you find out what plans your dentist may be in network for, there could be a waiting period before you get coverage for comprehensive dental, but it could be worth your while, especially if you're somebody that has a lot of issues with your teeth. So it's going to come down to the details of the specific plan that you're looking at. If in the alternative you are considering Medicare Advantage, in other words, Medicare Part C, a lot of those plans have dental built in. There's limits to the coverage, but it is part of the coverage. But remember, don't choose an Advantage plan because of dental coverage. Choose it if the Advantage plan is the right path for your healthcare coverage. And you start by finding a plan that your doctors are in network for, that your drugs are cost effective, and then once you find plans that meet that threshold, compare the dental coverage with the different plans to figure out which is going to be the best path.